My name is Charlotte King-Harris. I am a registered clinical counselor, a registered social worker, a registered play therapist, and a certified trauma treatment specialist. And I work in private practice in Oak Bay in Victoria, BC. I describe counseling like going shoe shopping. You need to find the right fit. And if you try and force your foot in the wrong shoe, you get blisters, it hurts, you don't want to go out shoe shopping ever again. So my job is to give them an opportunity to try it on and see how it feels. Most of the time, after they sit down and chat with me for 20 minutes, they're like, oh, this is not at all what I thought counseling was, right? This feels so relaxed and laid back and easy. Yeah, I'll give this a try. And I try and look for that, the edge between comfort and discomfort. So if a client is too comfortable, if all we're doing is just playing games the whole time and they're totally happy to be there, then progress might not happen, right? But if I sit them down and say, we really need to talk about your trauma, that might be far too uncomfortable and progress won't happen. So I look for that edge. And if somebody's really resistant to counseling, that edge is going to be a lot farther towards the just being comfortable side, if that makes sense, right? So will be a lot of playing games, and then maybe I'm like every once in a while asking a little question or two just to see if if those topics feel comfortable. By having a therapeutic playroom, I'm joining a child in their world and communicating with them in their language, which may not involve words at all. The theory behind play therapy is when they're in a room that's filled with a bunch of different therapeutically chosen toys, along with me, the therapist, who's the most important sort of toy in the playroom, they will naturally gravitate towards what they need to in order to communicate what they're struggling with. In my whole journey with my own mental health, I have found that knowledge is power. The more I could understand why I was having panic attacks, why I was feeling depressed, why I was reactive, why I was anxious, the easier it was to learn how to accept it and be okay with it and not be scared of it. I think that the majority of our suffering comes from when we try and avoid what we're feeling from moment to moment. And when we can understand why it's happening, it's much easier to accept it.